Hello and welcome everyone. Good afternoon. My name is Garuz Moses Yam, and with me here is a very amazing person, the name of Dr. Jane. Dr. Jane, is really nice to have you here.
Thank you,
So
girls.
today we'll be talking about endometriosis. So Dr. Jane, please can you enlighten us? Tell us what is endometriosis?
Okay, so endometriosis is a condition that
Okay.
is seen among women of reproductive age commonly,
Okay.
and is a state in which you find tissues that are supposed to line the womb
Yes.
in other places outside the womb,
Okay.
commonly surrounding the womb, like the fallopian tubes,
Yes.
the ovaries, around what we call the pelvis. Pelvis is like a bowl that holds all the reproductive organs together.
Okay.
So when you have tissues in places where they're not supposed to be, and those tissues are not just any tissues, but tissues lining the womb,
Okay.
we say that is endometriosis.
Wow, that's really, really something that people should actually look out for. It
Yes.
sounds so easy, but it's something you should actually pay attention to. So can you actually tell us the causes of endometriosis?
Well, endometriosis, the actual cause is not known
Okay.
among professionals and scientists, but there are some things which we call theories or some states that can explain the likely causes of this condition. For instance, there is this theory of what we call backward menstruation.
Okay.
In the medical parlance, we'll say retrograde menstruation. It just means that the menstrual flow, we're talking about the lining of the womb. Now, you now have this flow. Instead of flowing outwards through the cervix or the mouth of the womb to the
Yes,
vagina, you
vagina.
have some of it spilling through the
Fallopian
fallopian tubes,
tubes.
and some deposits are implanted or stays on the ovaries, fallopian tubes, the pelvis, and even just around the uterus. That is what we call the backward menstruation theory that can explain that in women that have obstructions in the outlet of their menstruum. You commonly see that in those group of women.
Okay.
We also have people that have genes that can easily, well, if it runs in the family, they
Yes.
can have that. Then sometimes some of the theories says this lining of the womb can actually travel within the blood vessels that
Okay.
is transported around the body.
Okay.
And that explains some of the kind of endometriosis you see with people that have brain symptoms,
Okay.
symptoms in their lungs, and all of that. Then we now have some cells. There's this theory that says some cells just change on their own
Wow.
to look like tissues in the lining of the womb. So that is just transformation, cell transformation theory. And
Yes.
that's when they transform, they now begin to act and behave like the tissues in the lining of the womb.
Wow.
So, through the menstrual cycle, the
Yes.
uterus, the lining of the womb grows, builds up, and breaks down as what is seen as menstruation. So,
Yes.
everywhere you have those abnormal tissues, for any reason they got there, or however they got there,
Hmm.
they tend to respond to these hormonal changes every month.
Okay.
And that gives us that chronic state of pain and all of that that they tend to have eventually.
Wow, okay. Thank you so much, Ma. So we also want to know, are there symptoms, signs and symptoms that women actually discover or notice before they have been diagnosed of this particular?
Well, yes, there are a lot of symptoms that women with this condition could present with.
Okay.
But commonly among the two, among most of the symptoms, topmost among them, you have what we call chronic pelvic pain. These women constantly have lower abdominal pain,
Mm.
for which they might visit a lot of facilities and they will be treated for infection severally, this, and that. So they have what we call chronic pelvic pain is one of the topmost
Okay.
when you see a woman of reproductive age with repeated pain. Then secondly, commonly they will present with infertility or what we call difficulties with conception. So that is another way they will commonly present. But
Okay.
that being said, they have a lot of ways they can present because I said these abnormal tissues can be found in all the structures down the in the pelvis or in the
Yes.
bowl that harbors. So down there we have the uterus, the fallopian tubes, the ovaries. You also have the bladder around the rectum or the anus, rectum leading to the anus there. These deposits can cause pain while passing stool.
Okay.
But commonly, what is characteristic about endometriosis is that most of your symptoms are period related. So you see
Okay.
women that have pain during their periods, passing stool. You see people that have blood in their urine, pain when they are passing, because remember that it's supposed to shed just like you shed the
Yes.
menstruation,
Yes,
so
that's
they
true.
can have bloody urine.
Okay.
Then for those that have, I talked about
Gene.
transportation
Mhm.
theory, where you have some of them carried in the blood.
Yeah.
Some of them can have chest symptoms. You see them coughing out blood
Wow.
during their periods.
Okay.
Those that have it up to their brains, they can actually have what we call convulsions or
Wow.
seizures during their period.
That's
So
severe.
it can just be those symptoms, you can see them in women that have endometriosis. So it can affect all the organs. And of course, that pain, then there's this deep pain they have when they have intercourse, is
Okay.
also a very characteristic symptom
Wow.
of endometriosis.
Wow. So then a lot of people need to look out for a lot of things that their body undergoes, because somebody would just maybe experience painful intercourse and just assume that, oh, I'm probably dry, or I feel I'm too tight. Do you understand? A lot of people just assume. That is why we always encourage people to always see a professional medical practitioner, just so you know that you're on the right track. You don't just assume that, oh, this is what is going on in my body. Meanwhile, that is not actually the ideal thing. So it is good that people actually come to the hospital, seek medical advice before they conclude on anything. And for some people, they can actually be having, maybe, let's say, pile. Meanwhile, it's actually endometriosis. Do you understand? Maybe a symptom of that, and then they'll just assume that, oh, it's just pile, it's nothing serious. Maybe if I should do something or do that, it should actually go back and all of that. So it's good that people out there actually seek professional medical advice on whatever it is that is going on in their body. I always emphasize on the fact that it's better you stay on the right track. Be certain. There's no question that is silly, and nobody will laugh at you because you want to know what's happening in your body. So it's good that you know what's happening. Be sure that, okay, I'm actually good, than for you to just assume that, oh, this will just come and go. Because a lot of people can be experiencing this maybe at a very early age. If they had come to the hospital, probably would have been diagnosed at a very early stage, and then could have been corrected or something would have been done. But a lot of people will experience changes like this and just feel like, oh, it's normal. It happens to anybody. So I'll be good. So please, viewers out there, you should actually seek professional medical advice when it comes to your health, when it comes to your body, and everything that has to do with you. Reason because we want the best for you, and we also want you to actually stay healthy. We want you to live a good and healthy life, a life that is worth living. We want you to fulfill your dreams. We want you to live happy. So that takes us to our next question, Dr. Jane. So how do we distinguish between endometriosis and then painful pelvic, like,
Conditions.
yes.
Well, endometriosis and other conditions that could cause chronic pelvic pain.
Yes, ma'am.
Well, most of them are interrelated, but typically for endometriosis, like I said, that the symptoms are period related.
Okay.
So you see a woman, someone that has significant pain during intercourse, during her period, because that is when this lining sheds.
Yes,
So
ma'am.
just like you have menstrual pain, just the central normal one that women would have, you now have it all over the place with other changes that it brings. Then you have basically that is what you have. And typically women with endometriosis, the menstrual pain is significant
Okay.
to affect their function, quality of life. You see, most of them would even present to the hospital whenever it's their period.
Oh,
Significant pain. Some of them would even have fever. That's
okay.
how significant the pain of endometriosis is.
Oh,
So it's typical with all, but other things you can do, other conditions that could come as chronic pelvic pain, like when we have pelvic inflammatory diseases like infection
yes.
of the reproductive tract, which is most what the commonest thing that people treat in place of endometriosis.
Yeah.
So when you have that, you can do some swab tests that can
Okay.
help with your diagnosis.
Yes.
When you have urinary problem, remember I told you they can pass blood, they can have pain when they are passing urine.
Yes,
You
you
can
did.
do urine tests that can pick some infections, and
Okay.
that will guide you. Then there are some other conditions like irritable bowel syndrome and all of that. There are a lot of them. But again, most importantly, you can do that by taking a very good history. Most times, your history guides you on the most appropriate thing to treat.
Yes.
Then, when you do examinations, for those that have endometriosis, you feel this hard nodule
Okay.
within. Yes, when you do it, you feel it very hard. That is deposit that has built up.
Wow.
And those are things that actually cause what we call adhesions and give
Yeah.
you all the trouble that you
There's this
have.
blockage
So
and
they
all of that.
feel all of those. You can feel that. Then, of course, differentiating it now, having done all of those, you can do an ultrasound scan.
Mm.
For most people with endometriosis, they have cysts, what we call endometriomas. And commonly, most young people, you say, I have a cyst, I have a cyst. But when you
Yes.
see a young woman with menstrual pain and cyst on both ovaries, because it's common to have bilateral cysts in
Wow.
endometriosis, then
Okay.
you suspect that there's endometriosis. So you see that differentiates your pelvic pain that could have been just a cyst and
Yes.
endometriosis. Then, of course, investigations. When you do laparoscopy, is said to be the standard way of diagnosing endometriosis.
Okay.
So when you go in, this is just a minor surgical procedure that you put a camera in a woman's belly, and when you do that, you will just see the endometriotic deposits. They look like powder bone, like match head. You know this head of match or match head, right?
Yes.
So those dark spots, that's how they appear on all the organs they have deposited on. So you could
On.
see them. And commonly these women now have this what we call a frozen pelvis. All
Wow.
the organs are jammed together. The tube is adhered to the ovary adhered to the body
Mm.
of the uterus. So when you go in, you see all of those, you can help make a diagnosis compared to when you just take. So your history, your examination, your
Yes.
investigations would help you differentiate chronic pelvic pain from endometriosis and other causes of chronic pelvic pain.
Wow. This is really, really serious. I just hope that our viewers out there can actually hear the way you're emphasizing on the kind of outcomes that comes with endometriosis when you don't treat it on time and all of that. This is something that people should actually look out for. It's very, very serious. So I want to know. I don't know if it's just me that wants to know, but I'm sure there's somebody out there that wants to know. So due to the adhesions that are there, let's say in the cervix and all of that, could that be the reason why people experience painful there's always pain during intercourse, or is there another reason?
No, basically that is, this
Because of the
chronic,
build-up,
yes,
yeah.
chronic buildup of the adhesions. You
Yes.
have that in a lot of places, those places in the around the uterus and all.
Yes.
Those things can cause, those adhesions can cause pain.
Mm.
Normally, even those with post-surgery adhesions can have pain. Then you can
Okay.
imagine someone that has then there's this thing we call chronic inflammatory states. It might be difficult for me to break this down, but every month as you are menstruating, there are these deposits that drop around.
Okay.
It's just like, so it causes, also it releases some things that can cause pain. There's this thing called prostaglandins, those things that can cause pain during labor,
Mm.
can release all those things around period and give you those significant pain you have in the pelvis too.
Okay, thank you, ma'am. So can we actually stage or classify endometriosis? Do we have like a stage one, a stage two, and so on?
Yes, we do.
Okay.
So the common one we use the staging by the American Society of Reproductive Medicine, and it
Okay.
has stages 1 to 4, or easily put, minimal, mild, moderate, and severe disease. And of course, as the name changes,
Yes.
it just tells you about deposits, how it affects, that's the deposits of the abnormal tissues on the organs and all of that. But it's very important to state at this point that this minimal, so the fact that I say minimal, mild, and all of that doesn't equate to minimal symptoms. So someone might have mild disease but have significant symptoms.
Symptoms,
So
yes.
the grade doesn't tell you about your symptoms,
Yes.
your fertility choices, and all of that. So I thought we should put that
Mhm.
out
That was
there.
actually like what I wanted to hear, because a lot of people out there will be going through something and then they'll just assume, oh, since it just comes and goes, I can still hold it in. I think I'm good, or let me just wait till it gets to this point before I actually seek for help and all of that. So if you're somebody like that and you're out there looking at me right now, I just wanted to know that you don't have to wait for any condition to get so bad before you get to the hospital. Just when you feel, oh, I'm having a slight headache, I feel nauseous, or I'm experiencing pain and all of that, you should actually come to the hospital. You don't have to wait till it's so bad, and then there's nothing else that can be done in some cases. And in some cases, well, something can be done, but maybe it would have damaged a lot of things. So you don't have to wait till it's so bad before you seek help. As early as possible, whenever you notice any changes, you should actually seek for help. That's beautiful, Dr. Jane. Thank you. So I want to know also, does endometriosis affect equality?
Yes, endometriosis affects egg quality significantly.
Okay.
Yeah, so this chronic state of menstruating in the within the belly now, normal menstruation flows out, but this one is there. So it surrounds the egg, affects egg quality, and also even prevents ovulation. So you can have an egg that is luteinized and ready for release, but they're not able to release. Then, of course, the whole adhesions, the merging of the organs together, also prevents the eggs from being released. So, yes, it significantly affects egg quality. And that is why when you're evaluating, the knowledge of endometriosis is there. Not just every pain is PID, like pelvic inflammatory disease,
Yes.
because the earlier you identify this condition, you can also offer them options of even freezing of organs, your gametes, egg freezing, and all of that, because it's like a progressive condition. The more build up of those lining or those tissues, the shedding monthly, month in, month out, keeps building, and that affects quality even more.
Okay, thank you so much. So I also want to know, what are the most reliable ways of actually diagnosing endometriosis? Do we do an ultrasound? Do we do MRI, a laparoscopy, or are there other things which is more reliable? Because there's maybe somebody will be feeling like, okay, I don't want to do laparoscopy and then come back and do ultrasound. I just want to go straight to the point. Just do this test and then know if I have this or not.
Well, every investigation helps you build up your diagnosis.
Okay.
And so an ultrasound will help you pick ovarian cysts. I told you that in endometriosis, you have
Yes.
bilateral cysts commonly. And these endometriomas, they have a typical appearance. It's this endometriosis just means this shedding of this menstruum retaining itself in the ovary, because ovary is like 50 most of the time is commonest sites for endometriosis. Yes, so the ultrasound helps. The MRI, that's the magnetic resonance imaging, it also helps, but not to make a diagnosis of endometriosis. It just helps to pick those deeply buried deposits of those tissues in the pelvis.
Okay.
But the gold standard, when we say gold standard, we mean this is the surest way to say, because you are now putting those cameras in the belly of the women, laparoscopy, and you see the deposits. And I've described they look like match hair. These we call them powder bonds. Some even look red like raspberries and all of that.
Yes.
So that is how they appear under the using a laparoscope, and that is said to be the gold standard. Sometimes you can actually take what we call biopsy. Biopsy means taking a part of that thing you are seeing
Yeah.
and passing it under a microscope
Microscope.
to give you, when you do that, you will see it appears like the uterine or lining of the uterus.
Uterus.
Then that also helps make your diagnosis. But that being said, even if you do a laparoscopy and you don't see any deposit, it doesn't rule out endometriosis.
Okay, thank you. So let's know, does lifestyle actually affect our health in the sense that it could actually lead to endometriosis? Because most times when patients come to the hospital and then you ask them their history and all of that, and in some of your investigations you do ask them, oh, do you drink? Do you smoke? How do you eat? Like, what's your lifestyle and all of that? So I want to know, does lifestyle have any effects when it comes to endometriosis?
Well, lifestyle doesn't have much to
Okay.
contribute to endometriosis. Remember, we said cause is unknown and
Yes.
disease, it is a disease of theories.
Mm.
So lifestyle doesn't do much. But remember that you have other conditions. You might be coming for infertility and all of that. Poor lifestyle choices can also affect your egg quality.
Mhm.
It can affect your ability to conceive spontaneously. can also affect semen quality. So all those choices can affect you. Even obesity
Yes.
can affect quality and all of that. But lifestyle choices with endometriosis, not so much.
Okay. Hi. So, Dr. Jane, do you have anything for our viewers out there? Do you have any advice you want to tell them? Because there are a lot of ladies right now that experience pain when they're having their monthly flow and all of that. And a lot of people just tend to just get any pain relief. They keep taking pain relief. In fact, before the whole thing starts, they've already bought a lot, like they've bought ibuprofen, they've bought diclofenac, they've bought all sorts of pain relief, and they're already ready to start taking. So we want to know, is that okay? Do you have anything to tell them? Must you actually take pain relief and just assume that, oh, I'm just having a stomach pain. When I take this and I feel good, it means I'm okay. Or they can actually come to the hospital to check their self and be sure that, yes, everything is going on well with them.
Well, my final words on endometriosis, as you said, as we described, is a very common condition. Not it is not easily diagnosed as you would expect it, but it's a common condition among women of reproductive age groups.
Yes.
And commonly, most women will present with painful, very significantly painful periods. When you said they go and buy over-the-counter medications, pain medicines, and all of
Yes.
that, endometriosis, that pain
It's
it's not a
different.
pain for over the counter.
Okay.
Most times you see them rolling on the floor in pains, crying.
Now, some of them
Like,
tend to take overdose
yes.
because
So
they don't know.
yes, so that pain is that significant.
Okay.
So when you have all those kind of conditions, then again, infertility or delayed fertility, they are the common ways they can present. But
Yes.
the message is that if we diagnose early, you can be offered options. If it's diagnosed early, some women can still go ahead to conceive on their own spontaneously.
Okay.
Then there are other options for those that have pattern tubes. They can be treated for their fertility options. They can have what we call intrauterine inseminations. Those that have pattern tubes,
Yes.
and also IVF is also an option for them.
Okay.
For the pain, pain can be managed. There are different options, like you mentioned, over-the-counter medications.
Yes.
You can use hormones such as the birth control pills.
Mhm.
We also have some testosterone derivatives, some drugs that can help reduce your symptoms. So most of these things work by affecting your menstrual cycle. Remember, we said this pain is as a result of constant building up and shedding off of this lining in
Yeah.
abnormal places.
Yes,
So
ma'am.
what these drugs do, they help prevent or alter or disrupt your menstrual cycle so you don't get your periods as frequent as they should come. So that
Yes.
helps relieve your pain. Of
Okay.
course, that is another way of managing pain. There are a lot of hormones you can use. Then even you can manage your pain with surgeries, either taking off those endometriotic deposits as they were in the womb. Then basically, finally, some would say if you take out the uterus and both ovaries, remember it's the ovaries that produces the hormones that your body responds to
Yes.
all around,
Yes.
then you are sure
But I
that you
don't
have
think
offered.
anybody will want to do that right
Well, they
now.
want to do that, for those that have completed family science and
Yes.
have been able to manage this pain. So it's
Mm.
also an option. So you have the conservative where pain is not much. You have the medical where you use drugs and hormones. Then you have your surgical
Surgical
options. And of course, your fertility options. You have IVF, you have intrauterine insemination. And
insemination
of course, some women get pregnant spontaneously.
spontaneously.
Yes.
All right. Thank you so much, Dr. Jane. It was really nice having you here. So,
Welcome.
for our viewers out there, just so you know, your body actually matters. You shouldn't just assume. I'm sure you heard how she kept emphasizing on the fact that this could actually affect your fertility, and we don't want that for you. So, please, whenever you experience any pain, any discomfort at all, remember that no question is silly, and it's best to stay on the right track than for you to assume and then probably end up in a very big mess. So please make sure you do come to the hospital. Remember that here at House Hospital, we love you, and then your health is a priority to us. Make sure that we give you absolutely the best when it comes to you. We don't play about you. So please feel free to come to the hospital anytime. Know that nobody here will laugh at you for asking any question. Your questions are very, very important because you are very, very important and you're special. So we hope to see you again next time. I mean your host, Charisma Yam, and of course, our beautiful guest here, Dr. Jane. Bye, and then see you next time.